In this world of technology, things are ever changing, rearranging. You need someone to help you out. I know someone who can. Come and take a journey with me as we go through the land of technology. You'll never be alone. You'll be with Paul Amadeus Lane in the Tech Zone.
Hello and welcome to the Tech Zone. I am Paul Amadeus Lane. Thank you so much for joining me. I'm so happy to have you with me, and I'm wishing you and your family safety as we deal with the pandemic of COVID-19. No matter where you're at in this country or in the world, you are definitely in my continued thoughts and prayers for safety. Let's make sure we listen to the experts, keeping that social distancing and staying at home if we have that order where we live, and only going out for essential things out there. This can truly help ones and save lives out there. Over the last few weeks, we have just witnessed how technology has just come to the forefront when it comes to the way we communicate and the way that we are living. There is an organization out there that really keeps us abreast of what's going on and how technology is really shifting the paradigm when it comes to health. We know some of our appointments that have been deemed non-essential have been canceled, but now doctors are implementing something that has been around for a few years but haven't really caught on like it has during COVID-19. And my next guest is going to talk about how telehealth is really a game changer right now to make sure that you and I are staying healthy during COVID-19. And I'm so happy to have with me right now one of the great minds in the tech world and just an amazing individual. We're talking about Steve Ewell, the Executive Director of the Consumer Technology Foundation. Steve, how are you, my friend?
I'm doing great, Paul. Always great to reconnect with you, and especially these days when we're all physically apart. Anytime I can see you on here and connect and talk about all the great things that's going on with tech these days.
Hey, I appreciate that, Steve. And I kind of talked about this in the intro before I brought you on. And that was, as we are dealing with the COVID-19 pandemic, we're starting to see things that we kind of talked about in the tech world really come into fruition, like digital health, telemedicine, teleconferencing. Steve, what has happened since COVID-19 that has kind of just brought these technologies to the forefront, and also just the benefit of having these technologies?
Sure. Well, certainly things like telecommuting and telemedicine and all these sorts of health technologies have been out there and in existence for some time, but COVID-19 has certainly driven home the need for these technologies and the opportunities for these technologies to really make a difference in all of our lives. As everyone is, spreading out and trying to figure out, how many jobs can still be done remotely and ways to make that work. That's something that we're seeing. Certainly, I'll say that, CTA and the CTA Foundation, we're working remote right now, as I know many are. And whether it is using, solutions like, Zoom and Skype and FaceTime and all these other types of technologies that are out there that can really help people stay connected, stay in touch. And that's something that I'm particularly interested in because the CTA Foundation has been focused on how do we address social isolation for older adults and people with disabilities over the last 8 years that we've been working. I see, even more opportunities for us to address those challenges, look at the great work that a lot of the nonprofits that we're working with are already doing, and how can we best apply those lessons learned to all of us as we're trying to live in this new environment.
And when we look at what COVID-19 has done for us as a society, it really has us really addressing what's essential and not essential. Before COVID-19, we thought essential was going to the store just to pick up some dessert. Now we realize essential is going to the store, making sure we have enough groceries, paper goods, and and all these other things so that we can survive. So when we look at this telehealth medicine, how are healthcare professionals implementing this, Steve? Can you give us an idea of how that's happening nowadays?
Sure. Well, there's a number of telehealth and telemedicine solutions that are out there. In fact, the Consumer Technology Association, in partnership with the American Telemedicine Association, just released a tool which you can access from cta.tech, highlighting all the different telemedicine type solutions that are out there. People can put in, what essentially they're looking for, and it helps them identify different tools that can be used. So it's a great resource to let people find the telehealth and telemedicine solutions that could be most useful. But really, I'd say it's a great opportunity to be able to connect. If you have a healthcare concern, you're able to talk to a medical professional through some of these solutions, using some of the health and wellness devices. There's a lot of remote sensors that can provide information as well. And especially these days when, if you don't have to be going to an emergency room or to a doctor's office, being able to make some of these connections remotely can really help address some of the concerns while still meeting the needs that we all have. If we've got a health concern and need a prescription or need something looked at, a lot of that can be done remotely.
And Steve, this is really right in your wheelhouse, being the Executive Director of the Consumer Technology Association Foundation, and that is looking at assistive and adaptive technologies. And Steve, how do you see this helping different startup companies out there who are gearing towards this as their mission? How do you think this is going to play a part in their development?
Well, I would say if a company has a solution that can help people work remotely, and I'd even say beyond work remotely, live independently wherever they want to be at the time they want to be, this is a great opportunity for those technologies to really prove themselves as people are out and about remotely. And that's something that, we're seeing a lot. I'm in constant contact with a lot of our grantees, the nonprofit organizations that are on the front line, serving the needs of older adults and serving the needs of people with disabilities. And, they're really challenged right now to help as many people as they can, whether they still need to be there physically, whether they're working through virtual solutions. So, there's a lot of great opportunities for technology to help these caregivers, help people around the country and around the world deliver the services that are needed to the people in the most need. So I see some great opportunities for innovators to come up with new solutions. I can't wait to see what people keep coming up with. Look forward to hearing about them and hopefully being able to, highlight a number of the solutions that worked well at CES in 2021.
And Steve, when we look at just the integral part of the CTA and the CTA Foundation, we really see it in action with telehealth. And the reason why I say that, Steve, you guys wanted to make sure there were some principles and values that govern ones who are involved with this. And Steve, can you share a little bit about those principles and guidelines that you guys fought so hard for to make sure those who are involved in telehealth live up to these principles?
Sure, I can give you a little bit of an update on that, and I will say, being the CTA Foundation, I'm not as directly involved in the government affairs and standards work, but I know CTA as the association has been doing a lot of great work around standards, and some of that has involved work in the telehealth space. And then the government affairs team is constantly working to try to help innovators get the solutions that are needed out there to as many people as possible. I'd say from a CTA Foundation space, we see some great opportunities to highlight and create awareness around the types of technologies that are out there. Help people use these technologies and really put them in the hands of people who can really keep people living independently as they would like.
And Steve, as we think about pre-COVID-19, our discussions that we've had, we've always both talked about independence, monitoring, using technology to do so. And Steve, now let's look post COVID-19, which we hope is sooner rather than later. Do you think that this is now going to be the norm, that we won't go back to the way we did things in the past, that the telehealth will take on a new life of its own, and all these things that can really help us, that God forbid if something like this ever were to happen again?
Yeah, well, obviously, really hope that there is an opportunity or we will have an opportunity, I know, to go back to a more semblance of the normal that we had before all of this. But I do think that there will be a lot of lessons learned from this. Whether it is being able to use telehealth, telemedicine, other solutions like that. Certainly we're seeing it with people being able to work remotely in many cases, and what lessons can be applied then as we all go back and see where there's opportunities to continue to work, live, and play as remotely when needed, but also find ways to bring people back together and get things going again as well.
I love it, Steve. I love it, Steve. And the foundation, you guys are continuing to be hard at work and just making sure things are in the forefront. And what are some things that you guys are doing behind the scenes that you would like the public or the industry or the assistive and adaptive community, aging adult community out there? What are some of the things you'd like to get across to them during this time?
Sure. Well, I will just stress that many of the organizations, both the groups that we've given grants to in the past, as well as many other nonprofit organizations that we're working with around the country, they're really, going all out to deliver the services that they need. The CTA Foundation is trying to offer as much support as we can to these organizations, whether that's through, support, through our financial support. We're going through our grant review process right now and should have some grants that we'll be giving out to organizations here in the next month. But we're also, helping make connections, helping, tie people together as far as learning best practices from one group to the next. And really, helping these organizations deliver what they can. We actually will be, it's not quite live on the CTA Foundation website yet, but we're going to be putting up a page here very soon that will highlight all the different resources from our grant recipients and other key partners. So, if you're looking for organizations that serve particular needs, whether it is, people with spinal cord injuries, vision loss, hearing loss, older adults, other groups along those lines, cognitive disabilities. There's so many of these nonprofits that are creating resources, posting them online. So we're helping pull all that together and share that. So we'll have that very soon. We're also working to pull together as many lessons as we can in addressing social isolation from the groups that have been doing this for years and in many cases decades, and seeing how we can best apply that really across society at this point.
I love it, Steve, and you guys are continuing to work hard. We appreciate having you out there, you and the crew, and all of that the CTA does and the CTA Foundation. And before I let you go, is there any technology in particular that you feel that we as a whole, whether able-bodied or ones who are part of the disabled community or the aging and adult community out there, is there one piece of technology you think that we should really look to right now during COVID-19 that can really just help us as a whole?
I would say at this point, one of the most important technologies really is some of the most basic technologies. So whether you're looking at, your phone, your tablets, other devices along those lines, because through the various apps, there's opportunities for you to connect, have a conversation like what we're having right now. There's also opportunities for you to, catch up on the latest TV shows and movies, which I am horribly behind, but hopefully one of these days I'll actually be able to catch up on. Read books, take classes. There's so many opportunities that you can get through information like that. Certainly I love all the different IoT devices, smart home devices that can really, help people, really control the environment around them and everything that comes with this. But if you're making me pick just one, I think I would go with, the phone and all the information that we can gather thanks to the internet. There's some really exciting things that we can do there. I'd certainly say when you're using that, you can go to places like CTA.tech. We have an entire resource center on there where, CTA, the market research team, who I know you talk with them all the time, but, they're doing some really great work pulling various pieces of information together, both for the industry, but also kind of letting people know how this is impacting, what people are buying, what people are using in technology right now, all the different other research and work going on there. They've pulled together a bunch of telehealth information as well. So I would certainly say people should go to CTA.tech. And then, of course, I have to say go to CTAfoundation.tech as well, because we're highlighting all the work that our grantees are doing and trying to share our lessons learned as well. So
I love it, Steve, and always a pleasure to talk to you, my friend, and looking forward to having more chats as we navigate through this pandemic that we are living through. But we really appreciate all that the organization is doing to help keep us abreast of things, as well as being at the forefront when it comes to see how technology can truly help us. We really appreciate it, my friend. You be well, okay?
Well, you stay healthy as well, and thank you for what you're doing, because getting the information out there, now is really an important time to be sharing all the work that technology can do, helping people understand, what they can use and how to best do that. So thank you for what you're doing and continuing to spread the good news.
My pleasure, my friend. Always enjoy talking to my great friend Steve Ewell over at the Consumer Technology Association Foundation, and also all the great work that the CTA is doing, advocating for us, making sure the policies are in place when we introduce these telehealth technology, that things are done the right way. All right, when we get back, we're actually going to talk about a company that kind of Steve talked about, not in particular, but a company that the CTA Foundation has helped a few years back at CES, and check out some of the marvelous things they just put in place less than 3 weeks ago to help when it comes to this coronavirus pandemic that we're dealing with. Stay tuned. We'll be right back after this.
In this world of technology, things are ever changing, rearranging. You need someone to help you out. I know someone who can. Come and take a journey with me as we go through the land of technology. You'll never be alone. You'll be with Paul Amadeus Lane in the tech zone.